Hi everyone, I'm Dr. Samir Davia, and I'm a facial plastic and reconstructive surgeon in Princeton, New Jersey. And today I wanted to cover what a brow lift, also known as a forehead lift, is and what to expect if you decide to have one. So brow lift is a procedure designed to treat deep wrinkles on the forehead and droopy eyebrows. It's a procedure that can be done non-surgically or surgically, depending on your anatomy. And most patients are interested in this because they feel like they look tired or angry when they really aren't. I work to achieve a subtle, refreshed, and well-rested look. For men and women, it's a little bit different. So for women, it's important to emphasize the natural curve and higher resting position of the brow. For men, it's important that the eyebrows are straight and closer to the eyelid. I make sure to tailor each brow lift to the individual patient to ensure that the most appropriate height and shape can be achieved with each face. So the procedure for a surgical brow lift is done on an outpatient basis and is typically done under general anesthesia. And the better news is that there's really very little pain or swelling. The sutures are typically removed between days 7 to 10, and patients return to work within a week. Usually exercise is restricted to about 3 weeks, and there's a little bit of numbness on your forehead. That will go away within a few weeks also. Now, the type of surgical brow lift will depend a lot on the patient's anatomy and the height of the forehead. If someone has a forehead that's less than 7 centimeters, we can use something called an endoscopic brow lift. However, if the forehead height is greater than 7 centimeters, we typically have to remove skin, and this is done as an open procedure. In both cases, the incisions are hidden. So for some patients, it may be more appropriate to use things like Botox, Dysport, Juvederm, and Restylane, because surgery really isn't that appropriate. So I'll work with each patient to decide what procedure is right for them.